My name is Dr. David Provost, and you're watching the Weight Loss Surgery channel.
Hi, and welcome to WLS News. I'm Leslie Thompson, and thank you for joining us today. Coming up in this week's report, we'll tell you about a new clinical trial for an innovative bariatric procedure that doesn't require surgery. We'll also take a look at the rise in cancer rates related to obesity and explore the world of medical tourism for patients seeking weight loss surgery outside the United States. And of course, our intrepid web reporter, Yvonne McCarthy, will point us to some of the best sites for weight loss surgery information and support. All of that is coming up, but first, former President Clinton is leading the charge in the fight against childhood obesity by spearheading a new program called the Alliance Healthcare Initiative, a joint project of the American Heart Association and the William J. Clinton Foundation.
As a result of this collaboration and our agreements, nearly 1 million children in the United States now have access to new health care benefits to combat obesity. The Alliance Healthcare Initiative will continue to recruit health insurance companies and employers to participate. Our goal is to have more than 6.2 million children with access to this health care benefit within 3 years.
Currently, more than a third of all children in the United States are overweight or obese, which not only puts the children's health at risk, but can also mean skyrocketing health care costs for their parents. The initiative would provide funding to reimburse doctors and registered dietitians for providing health care and nutritional counseling to obese children and their parents on an ongoing basis. Billed as the first of its kind, the project links medical organizations like the American Academy of Pediatrics and the American Dietetic Association with major insurance carriers and large privately held companies to provide benefits that are designed to stop the trend of childhood obesity. The project is expected to help address the health care needs of about 1 million children in the first year and more than 6 million children within 3 years. In our next story, we all know that eating too much fat is bad for you, but do you know why? Aside from expanding your waistline, consuming too much fat can cause serious health risks. Most recently, researchers from the University of Cincinnati have discovered evidence that eating a high-fat diet, even for a short time, may cause dangerous inflammation of the arteries that supply blood to the heart. In the study, which was funded by the National Institutes of Health, researchers fed mice a high-fat diet for 2 weeks. They discovered that the fat cells surrounding each mouse's coronary arteries became swollen even in this short amount of time. And since the coronary arteries supply oxygen and nutrients to the muscles of the heart, this swelling can cause a risk of major heart problems. According to the study, a high-fat diet may be especially dangerous in part because the health risks can go unnoticed. The inflammation of the arteries does not appear to be connected to weight gain, the amount of lipids in the blood, or cholesterol levels, meaning that a person could have this condition without knowing it. One more good reason to avoid eating high-fat foods. When we come back, we'll talk with one of the doctors involved in a new clinical trial for a weight loss procedure that doesn't require surgery. And Yvonne McCarthy will tell us what's happening in the world of weight loss surgery online. So stay where you are, and we'll be right back after the break.
The Weight Loss Surgery News brought to you by Bariatric Advantage. Ask about the Advantage Reward Program because you deserve it.
After weight loss surgery, it can be hard to get enough vitamins and nutrients in your diet. Bariatric Advantage offers a complete line of nutritional products specifically formulated to meet the unique needs of bariatric patients. Choosing to have weight loss surgery was a big decision and required a big investment. Learn how Bariatric Advantage nutritional supplements can help you get the most from your surgery by keeping your new body healthy and strong. Call us toll-free at 800-898-6888 or visit us online at bariatricadvantage.com.